During the Delta surge, can vaccinated people eat indoors, travel, or go to the movies? What is experts saying? It can be difficult to live in a world where the COVID-19 Delta variation is on the rise, but it all boils down to personal risk factors and transmission rates. People who have been vaccinated yet have underlying conditions should take extra precautions to protect their health. Others may wish to keep wearing masks if they come into touch with immunocompromised persons or children who aren't old enough to be vaccinated. We're at a particularly perplexing time in the pandemic for the 50% of Americans who have been completely vaccinated, as cases of the Delta strain surge, and COVID-19 infections shatter new records in some places. The immunizations, we're informed, offer excellent protection against serious illness, hospitalization, and death, but that vaccinated persons should continue to wear masks in specific settings. It can be difficult to navigate life when the Delta variant is soaring, but it all boils down to your particular risk factors and the transmission rates in your immediate environment. Here are some of the factors that experts suggest vaccinated persons should consider while deciding what activities are safe to engage in during the Delta surge. Knowing how much risk you can take. It's critical to consider two elements when determining what's safe to do after getting vaccinated: your particular risk factors and the cases in your neighborhood. Even if they've been vaccinated, certain persons may have an increased risk of having a serious COVID-19 infection. Furthermore, if adults are going to interact with those who are immunocompromised or children who are too young to be vaccinated, they should take extra precautions to protect their health and reduce the risk of contracting the disease so they don't pass it on to others. In areas with low vaccination rates and high levels of community spread, people who are high risk, such as those who have had a solid organ transplant, will need to take extra precautions. While vaccinated people are unlikely to experience serious symptoms, they may still be at risk for long-term COVID-19 infection. Vaccines reduce your chances of contracting a serious illness. Vaccinated people should feel quite comfortable living their lives right now. Consider that we're in the midst of a particularly active flu season, with influenza spreading all over the place. You wouldn't necessarily be a hermit, but you'd be cautious, adding that you might not become sick, but you wouldn't want to catch it anyhow. People with a lot of comorbidities or major underlying health concerns should be particularly cautious when doing specific activities, whether it's a bad flu season or a COVID outbreak. If you're ever worried about getting a breakthrough infection, a good mask that fits your face well will help. Furthermore, if you come into contact with persons who are vulnerable, you should take these extra steps to avoid contracting the sickness and then spreading it to them. What to think about when participating in various activities: consider your personal risk tolerance and local transmission with each action. With that in mind, scientists say it's safe to undertake the following right now if you're completely vaccinated. Indoor dining. If you don't feel at risk and don't have a serious health problem, dining indoors is a viable option. If you are at a higher risk or are in contact with someone who is immunocompromised, you should eat outside. Small indoor meetings with all attendees having been vaccinated. This is quite secure. It's about as safe as you can get in an environment when everyone is vaccinated. Infections are spreading, so anyone with symptoms like a runny nose or a scratchy throat should avoid this one. Indoor concerts or events will not be safe going to a crowded indoor performance right now because Delta cases are on the rise. But, once again, it's a matter of personal preference. In a circumstance like this, the chance of exposure is significant, but the immunizations will protect you. If you develop a breakthrough infection, you'll probably be fine, but you may get sick after that, according to the experts. Wearing a well-fitting mask in a crowded indoor location if you really want to avoid even a breakthrough infection. You should probably avoid this one if you have any medical issues that raise your risk. Concerts and events held outside. It is far safer to attend an outdoor concert or athletic event. When there's good airflow, you're less likely to get infected with a high viral load. You can always wear a mask if you're worried about your personal risk. Traveling or flying, on planes, the air movement and ventilation are excellent, and there haven't been many recorded incidents of transmission. On flights, masks are still required. Going to cinema. This isn't a problem for people who are otherwise healthy and have been vaccinated. All of these activities are related to a person's personal risk tolerance. COVID-19 will not be eradicated, according to experts, and cases will never go away. People don't seem to realize that COVID-19 is something we'll have to live with forever. COVID-19 is an endemic respiratory virus that will never go away. Most persons who have been vaccinated will only have moderate symptoms if they acquire a breakthrough case. In the end, as the Delta version grows in popularity, figuring out what you can and can't do becomes more difficult. Experts in infectious diseases indicate that people who are normally healthy and vaccinated are well protected from severe COVID-19 cases, but that if you have a higher risk of complications, you should take extra precautions.